Well, good afternoon, everyone. My name is Bill Keck. I'm chair of the Academic Health Department Learning Community and the Council on Linkages. And it's my pleasure to welcome everyone to today's Academic Health Department Learning Community webinar. Before we begin, however, I'd like to ask Kathleen Amos to go over some of the housekeeping items associated with the GoToWebinar software we're using today. So Kathleen, if you would.
Great, thank you, Bill. So as Bill mentioned, before we get started, we do like to run through a few housekeeping items. So on the slide here, you should see an image of the attendee control panel, which you should also see on the right-hand side of your computer screen. So first, we wanted to let you know that all attendees are currently muted. In the control panel, towards the top, you should see an audio section. For audio, you have the option of listening through your computer speakers or calling in on a phone. If you're using your phone, please choose the phone call option in that audio panel and enter your audio PIN, which is also found in that panel. If you are using your computer speakers and mic, please choose the computer audio option. We do have slides for today's presentation, and those are available for download in the handout section of that control panel if you'd like to follow along that way or take notes. Throughout the webinar, please feel free to submit your questions or comments via the questions box, again, in that control panel. You can send your questions in for either of our presenters at any time, and we'll hold those all and we'll have time for Q&A and discussion towards the end of the webinar. So we'll queue them up at that point. When we get to that point in the webinar as well, you will have the ability to ask a question verbally if you care to do so. So all you'll need to do is raise your hand and we can unmute your phone line and you can ask your question. And finally, we just wanted to let you know that we are recording the webinar today, and the archive will be available following the webinar to you and to others who were unable to join us. So that's all I have, Bill. Thank you very much.
Indeed. Thank you, Kathleen. Let's get on then to the next slide. Some of you on the call are new to us, so I want to take just a few moments to fill you in a bit about our learning community background. We are a product of the Council on Linkages between academia and public health practice, and we're staffed by folks from the Public Health Foundation in Washington. The Council is made up now of 23 national public health organizations, including the Centers for Disease Control and HRSA. Our funding, for which we're very thankful, comes principally from the CDC. We have three major goals for the Council that are listed on the slide for you. And as you can see, all of them are related in one way or another to linking academia and practice in public health. We're often asked then just what an academic health department actually is. A wide range of agencies, institutions, and arrangements actually are involved in these partnerships, making a tight definition difficult and perhaps unnecessary. This slide does contain some of the phrases we use to describe these arrangements, and we present them here in hope that they may be helpful to understanding and perhaps useful to you. The Council on Linkages is perhaps best known for its work to develop core competencies for public health workers. But on the next slide, we note that the Academic Health Department Learning Community is one of our newer efforts. The learning community is now in its 8th year, which is amazing to me in a way, but it is now in its 8th year. Our activities are noted in the bullet points on this slide. If you're not a member and wish to join us, just drop an email to Kathleen, whom you've just heard, at kamos, K-A-M-O-S, at phf.org. Our entrance requirements are very high. All we need to know is your interest and you'll be added to our list. And on the next slide, then, we put together some fast facts for you about the learning community. Actually, the one that impresses me most is that our numbers have grown to more than 800 individuals since we began in 2011. Well, then let's move on to the core content, if you will, of today's webinar. Our speakers today are Jessica Kronstadt, Director of Research and Evaluation from the Public Health Accreditation Board, and Laura Razor-King, Executive Director of the Council on Education for Public Health. We've asked Jessica to speak first. She'll be followed then by Laura, and then we'll get into our question and answer session. So Jessica, please take it away.
Great, thank you. Thank you, Bill, and thank you all for joining us on this topic. I think this is a really important discussion, and I'm so glad to see that so many of you are interested in hearing how health departments and academia can work together to support Public Health Accreditation Board accreditation. So I'm hoping that many of you are familiar with the Public Health Accreditation Board, or PHAB as we like to be known. So I'm going to give just a really brief overview about our accreditation program and then really get into the heart of the matter. So as you can see from this goal statement, we run a national voluntary accreditation program, and we accredit state, local, tribal, and territorial public health departments. And our purpose really is to improve the public's health by advancing and ultimately transforming the quality and performance of governmental health departments. And I should say, even though the entities that we're accrediting are the governmental health departments, throughout all of the accreditation standards, we have a real emphasis on partnerships and collaborations with various other organizations in the community, including academic institutions. I will also note that we are a fairly young organization. We actually just celebrated our 10th anniversary. We spent the first several years developing the standards and measures and the accreditation process and testing them. And then starting just in 2011, we opened the doors for the first applications, and we accredited our first health departments in February of 2013. And we have really gone a long way since then. Here is a map showing the states in dark blue are the states that have at least one accredited health department. And if your eyesight is good or you have a big enough monitor, you can actually see the number of accredited health departments in each state. But I will say this map is outdated because just yesterday we let 9 more health departments know that they were accredited. So we now have a total of 220 state, local, and tribal health departments that are accredited, as well as the centralized system in the state of Florida. And then we have another 150 plus health departments that are currently going through the process. As you can see from this map, we have really good geographic coverage. We're very excited that we reach to almost all the states in across the country. And we certainly encourage you all, if we have anyone from Alaska or Hawaii or a couple of these other states that haven't yet, thrown their hat formally into the ring, we hope that you'll be joining us soon. So the core of the accreditation program are the standards and measures. This diagram may be familiar for you. This is the 10 essential public health services. And those really form the backbone of our standards and measures. We organize them into 12 domains, so 10 of them correspond very closely with the essential public health services. And then we have 2 additional domains for administrative and management capacity and for the relationship between the health department and its governing entity. So the way accreditation works, in the simplest form, it takes a lot longer. I'm going to tell you this in about 15 seconds, but it's a multi-year process for many health departments. Is first they assess their readiness, then they submit documentation for all of our measures. We have approximately 100 measures, which are organized in these 12 domains. And then they are reviewed by a set of peer site visitors who are first review the documentation and then go on site and actually visit them before writing a report that then goes to the accreditation committee, which makes the determination about whether the health department can be accredited at that time or if it needs to do additional work. But really, as you can see, the heart of this is the standards and measures. And so I'm going to start there by highlighting a few areas within the standards and measures where collaboration with academia is most obvious. Some really great opportunities where health departments can, and in fact, in some cases are required to have relationships with universities and other academic partners. So the first area is Domain 8, which deals with workforce. So we have a standard in there that is really dedicated to developing the public health workforce pipeline. So we ask here, and the language here for measure 8.1.1 is the state version of the requirement. For most cases, the requirements are the same for state and local health departments. There are a few exceptions. So in this case, the wording is a little bit different, and states are explicitly required to collaborate with educational programs to develop the future public health workers. For local health departments, they're simply required to have partnerships, and we don't specify what type of partnership. But clearly, it is very essential for the health of health departments to make sure that they are participating in getting that, that pipeline going. And so this can take the form of mentorships, practicums, other ways that schools can work with the health departments to keep people interested in pursuing a career in public health. The other standard in this domain talks about having a competent workforce. Part of this is the development of a workforce development plan, and there's really an emphasis both in this standard as well as elsewhere in the standards and measures on the professional and career development of staff. So here's another opportunity where academic institutions might be able to provide some of the training that is necessary to help health departments fill the gaps in the competencies and the knowledge of their workforce. Another obvious place to go is we have a domain that is all about research. And so clearly there are linkages here between academia and health departments. So the requirement here, there are a couple of requirements. One is that health departments are able to use evidence-based or promising practices when they're implementing or improving their programs. And so this is another area where academic institutions might be able to help health departments to identify which evidence is most applicable to them. And then you'll see here, this is, you'll notice next to measure 10.1.2, it has that little TS next to it. So this means that this is a requirement just for tribal and state health departments. But there is a separate requirement that is about having relationships with academic institutions and other researchers to foster research. And so this includes things like being involved in an research agenda setting process, or being involved in participatory research. So we really are requiring particularly state health departments to be engaged in the research that is going on in their states relevant to public health. We also do have a second standard that is about understanding and use of research. So that one of the requirements here is that health departments have access to expertise to be able to analyze research. And we're very deliberate with the terminology access to expertise. That means it can be in the health department, but health departments can also demonstrate conformity with this measure by showing their partnerships with experts at academic and other settings. And then the last measure that I want to draw your attention to is, again, specific to state and tribal health departments, but is about providing technical assistance to other types of health departments. So the state providing technical assistance to tribal and local health departments, for example, and other public health system partners, in this case related to research results. There are actually several other measures throughout the domains that are they're only requirements for states, but they require states to provide technical assistance to local health departments and others. And when we say that the state health department is required to provide that technical assistance, that doesn't mean that the state health department has to be the one providing the trainings directly. One of the ways that they could meet these measures is by partnering with an academic institution or another technical assistance provider to make sure that those trainings are available, or those resources are available to local health departments in their state. So here's another opportunity, both in this domain 10 measure, but also in the technical assistance measures related to quality improvement. We have another one related to summaries of community data. So there are a couple places sprinkled throughout the standards and measures where we are holding states accountable to making sure that local health departments have access to the resources that could help them in those areas. One of the foundations of the standards and measures, and one of the really core requirements, is the community health assessment and the community health improvement plan. I think these are ones that you are probably all very familiar with, but these are also areas where we see a lot of collaboration between health departments and academic institutions. So on this slide, I have a reference to one article that describes some of those projects, but I will say that we are aware of many other schools where students as part of a class may actually be working with a local health department to help them either collect data or analyze it or present it. In fact, I will say that PHAB has worked with a number of students who've had practicum experiences with PHAB, and several of them have shared with us that, one of their classes, or one of the reasons they were interested in PHAB or learned about PHAB is because in one of their classes, they had worked with the local health department in preparing the community health assessment and the community health improvement plan. In addition to students helping, with gathering those data or presenting those data, we often know that academic partners serve as subject matter experts. So I know we've done an analysis of the community health assessments and the community health improvement plans. And when you look at the list of partners that they have, universities are very commonly mentioned as one of the partners that the community uses when they are developing the community health assessment and then prioritizing it and coming up with their implementation plan. So one shouldn't be limited. So those are some of the obvious touch points for where academia can partner with health departments in preparation for PHAB accreditation, but those certainly are not the only opportunities. And we'd love to hear if later on in the Q&A and discussion, if you have other thoughts, we would love to hear them. This was an article that we came upon. This was not someone that we had any direct contact with at PHAB, but it was written by a faculty member at a law school who partnered with their public health program to teach a course where they worked with a health department pursuing accreditation and helped them with the measures in Domain 6, which is where we talk about public health law and policy. And so they helped do an analysis of the relevant public health laws there to prepare the health department to meet those standards and measures. So this is really a way of encouraging you to think beyond, necessarily, this might be opportunities for public health to partner with other parts of an academic institution and really to think creatively about the various ways in which universities could provide some assistance to health departments. Another approach is one, and I have a reference here for one of the articles, is about actually helping health departments with their readiness. So before health departments apply to PHAB, we really hope they've taken some time to go through and see how they do against the standards and measures and identify gaps and then work to fill them. In the state of Kentucky, the University of Kentucky has played an active role in helping to convene health departments, local health departments that are pursuing accreditation, and to give them the resources that they need as they begin their preparation. So that's another thing that's not specific to meeting any one standard or measure, but really helping to convene health departments so that they can do all the things that they need to do to assess their readiness, to get organized, and also just to have a chance to talk amongst themselves and strategize about ways to approach accreditation. And the last thing I will say on this is that it doesn't end when a health department is accredited. So health departments are required to report to PHAB annually after they're accredited, and they also do have to apply and go through the reaccreditation process every 5 years. So we don't think that a health department, once they're accredited, should say, okay, we did that, let's check that off the list and we're done. What we do hope happens, and we believe happens in most cases, is that health departments go get accredited, but they realize there are always opportunities for improvement that have been identified by the site visitors and by the accreditation committee. So we expect that they're continuing to work through those items. We're also expecting the health department to be on top of emerging issues. So our standards and measures have already gone through one revision, and they will go through future revisions, because as the field of public health evolves, so will our standards. So we really do want health departments to continue to be on the cutting edge of important issues. And that is another opportunity, I think, for academic partnerships to really help ensure that health departments are keeping up with that cutting edge. My last slide is just to point you to some other items. So these are cases where these are not necessarily ways to help the health department prepare for accreditation, but they are things that I think will be of interest to both the academic and the health department audience. And a lot of these resources are on the research and evaluation page. One of the things I will point out is that we do have a research agenda. Those are questions that PHAB has identified for wanting to understand accreditation better. And so we have a list of questions that we hope that researchers will engage in, and indeed some have. We do make our data available for research purposes using a data use agreement. So this is something to keep in mind if there are students who are looking to write dissertations. For example, we've worked with several students on research questions related to accreditation. In addition to research about accreditation, one of the things, as I mentioned earlier, we will be revising the standards and measures, and we are very interested in research about the standards and measures. So if we have, we mentioned, we have a standard about workforce development plans. So if there is research that is conducted about the effect of having a workforce development plan or what components of a workforce development plan are most critical, PHAB would love to learn about those so we can make sure that, just as I said, we want health departments to continue to evolve, we want PHAB to be able to continue to evolve with that growing evidence base. We also have on our website a list of references for those who are interested in learning more. There's been one issue, or there have been several issues of the Journal of Public Health Management and Practice that have been devoted to accreditation. The most recent one was in 2014, but if you're a little patient and wait a month or two, there's another supplement that's coming out that is focused solely on public health accreditation. And then we also do have information about our evaluations. If you're interested in learning more about accreditation and its impact, we do have that information available. So with that, I'm just going to leave here for a moment. Here's my contact information. I'm really looking forward to the discussion at the end of today's call, and I will turn it over to Laura.
Thank you, Jessica. I would like to just say I say ditto to everything that you said. She did a great job giving a presentation that will align perfectly with mine, because we have a lot of the same expectations of our schools and programs in public health and higher education institutions as PHAB has for their health departments. And so I think you'll see that that they align very nicely. My name is Laura Racer-King, and I'm the Executive Director of CEPH. I'm going to follow a similar pattern to Jessica and tell you a little bit about what we do, and then talk to you about the areas in which I think academic health departments can really serve as a benefit to accreditation. So our mission is assuring the quality of public health education and training, and achieving excellence in practice, research, and service. And it is so important to us that to collaborate with organizational and community partners that it actually appears in our mission. All that we do is we promote quality, we assure the public of that quality, and we encourage improvements in the quality of public health education. We were established in 1974, so we've been doing this for longer than health department accreditation, and we accredit currently in 46 states, the District of Columbia, Puerto Rico, and also in 5 countries outside of the US. So you can see from, I put kind of the mission of academic health departments, or the purpose of academic health departments on this slide, because I thought it really sort of stuck out to me that their mission, their purpose aligns very closely with what our purpose is. They exist to strengthen the linkage between public health practice and academics, and they're designed to enhance public health education, training, research, and service, which is really bottom line what we exist to do as well. And that they can serve as public health training sites. And I'm going to talk about that a little bit more in detail, because I think that's a really important component. So we accredit currently 191 schools and programs in public health. And you can see on the slide the breakdown. It's important to know, this is relatively new for us. We accredit schools of public health, which can include a whole array of degree programs from the baccalaureate to the doctoral level, as well as some degree programs that are more academic in nature. So Master of Science programs that are very research oriented, for example. We are also rapidly growing, very much like PHAB. So we have about 50 schools and programs that are currently applicants, and that means that the 191 will increase by approximately 50 over the next 3 years. As I said, we accredit all over the United States, as well as in 5 countries outside the United States, and those are the countries that we also work in. So something that you probably have heard about if you're at all familiar with CEPH accreditation is that we adopted new criteria in 2016. So, and criteria are very much, it's sort of another word for standards, but they're interchangeable. So while PHAB uses standards, we use criteria. And all of our schools and programs are expected to come into compliance with the new criteria on December 31st, 2018. And we've made several important shifts that I think are relevant here. We've really shifted our emphasis to outcomes rather than input. So we're doing sort of less counting, and we're doing more looking at the impact of some of the activities that our schools and programs are doing, both in terms of student learning, as well as some of the other aspects like research and service that our programs and schools focus on. We also, while in the past we have had a lot of emphasis on partnership with communities, and by communities we mean the workforce, the public health workforce broadly. They were sort of spread all out in our previous criteria all over. We've done some concentrating and pulling them together in the last iteration of the criteria. And while they're still spread out a little bit, so you can see this is just a picture of the table of contents. Those are the criteria in very tiny print that you can see. And the circles are the areas in which we have some of the partnership with community aspects incorporated. So I'm going to go through, as Jessica did, some of the areas that I think are the most obvious ones for partnership. First of all of our MPH students and DRPH students are required to complete applied practice experiences. So in the past, these have been they were called practicum experiences, so essentially internships. We've shifted that focus a little bit now and called them applied practice experiences, with the idea that they could either be sort of in the older model of an internship, which is a wonderful way to get some applied practice experience, but it could also be, and we hope it will be in the future, kind of spread throughout the curriculum. And so that students are getting, rather than sort of one experience just at the end of the program, that there's really a lot more integration with public health practice throughout the curriculum. So you can see that on this slide, there are some specific academic outcomes that students have to achieve. So addressing competency attainment in those practice experiences, but they're a little more flexible. So they could be individual, or they could be small groups of students. They can be a longer term project, or they can be very discrete types of activities that they're doing in the practice community. The other important thing here is that it's really focused more on the outcomes. So we are looking at actual student products that they've produced when they're working on these applied practice experiences, rather than kind of counting the hours that they're sitting in an external agency. So here are examples. We've moved from a sort of the old 5 core area model of education. So everybody took a class in biostatistics, epidemiology, environmental health, health services administration, and social and behavioral sciences. We've moved from that to a competency model. So students are expected to attain 12 foundational knowledge areas, as well as 22 foundational competencies, all MPH students are required to attain. And these are just examples of, these are actually 6 of the 22 competencies. So these are the kinds of things that students are needing to do and to learn in a real practice environment. And so these are some of the kinds of things that Jessica was talking about with students helping with data analysis or collecting data. These are all kinds of things that students are going to need to be doing and getting practice doing, but also might be able to help health departments as they are also learning. One particular strength I think that academic health departments have is that it's not only schools and programs in public health that partner with health departments, but it may also be nursing schools and medical schools, nutrition programs and dietetics, all kinds of interprofessional activity and interprofessional opportunities for students to be learning. One of their competencies that they have to be able to demonstrate at the end of their academic program is performing effectively on interprofessional teams. And so if there is an academic health department in partnership with a health science center with multiple kinds of schools, I think that might provide some very interesting opportunities for training, not only for students, but also for health department personnel. Like what Jessica was talking about, there are also other opportunities besides simply student learning or student internship type experiences that I think can be valuable. And one is the way that academia really needs practitioners. And we actually require that schools and programs incorporate faculty who have practice experience. And so if there is an academic and practice partnership already established, those kinds of interchanges between the two settings can really be something very, very case-based. So it could be a guest lecture in a class, or it could be that a very experienced member of the staff in a health department in a particular area could offer an entire course, and students could learn directly from practitioners. We also require that those practice faculty be involved in program governance decisions, so that if they are on faculty, you're certainly getting all of the perspectives from different types of faculty. Scholarship and faculty scholarship and faculty research, I think, is another area of collaboration. We look and consider it an important outcome measure that faculty not only have more, what am I trying to say? Research that doesn't involve the community. We also look to see that some of the research portfolio, at least, it works very closely with the community. And so I think that is an opportunity for partnership as well, which also goes along with extramural service. We require that faculty provide service, not only to the profession, but also to the community and to the workforce. So while faculty members might serve on journal review committees, or they might serve on grant review type boards, that's some sort of service to the community, providing leadership in public health organizations. We also look to see that they're actually providing service to their community of interest. And so if there is an academic health department involved, that's a natural partnership in that area as well. Again, we require not only that that this is done on kind of a goodwill basis. We actually think that it's incredibly important to have practice input into student outcomes, curriculum, as well as overall the overall planning processes in programs. So the schools or programs that you might reach out to or work with as health departments, they're also going to want your input on things like what are some emerging competencies in the field, because as public health changes, so should the curriculum in schools of public health and programs in public health. So, and the best way to get that information is by involving the people who are actually in the field and practicing public health. So, so practitioners from the health department may be asked for their opinion about concentration competencies, for example, or maybe the content of a new course. And that is really important feedback for those programs to get. The other thing that we require all of the schools and programs to do is to provide professional development opportunities for their communities. And one of the main ways that they do that is that they provide technical assistance or professional development to their state, local, and tribal health departments. It can be formal, it can be informal. Either way, they need to be providing that service, and we also require that they assess the needs of the professional development that they provide. So they aren't necessarily saying, I'm going to offer this class because I have to for accreditation because it's an area that I'm very interested in. That's great, but if their partners don't need professional development in that area and they need something else, it's not very helpful. So we actually require that they gather information about what kinds of professional development is needed, and then provide what is actually needed. And we require examples of that. So I think that's an important way to partner. I just wanted to show this slide really briefly. And again, it sort of illustrates how much emphasis that we put on the partnerships in the public health practice community. It talks about the overall programs, the academic programs, and their evaluation and planning. So we require that they collect a lot of data and a lot of input over on the right about what they are doing and what kinds of outcomes, surveys, student opinions, graduation rates, those kinds of things. We require that they feed that into their planning process. But you'll see over on the left in the purple box that we also require, in an equal way, feedback from the community. So employer feedback is something that is incredibly important. Practice supervisor feedback. Many schools and programs have advisory boards that practitioners serve on and provide a lot of sort of real-time, real-world feedback into the academic program. And those data are just as important as collecting numerical data on graduation rates or job placement rates or whatever it is in the academic program as well. So all of that feeds in together for what we would consider a comprehensive continuous improvement process. So if you have any questions about partnerships, accreditation, kinds of examples, my staff are always happy to answer any questions that you might have. And we also offer a whole lot of technical assistance on our website, and I provided a couple of links there as well. So I think at this point, I'm going to turn it back to Bill and move on from there.
Excellent, Laura. Thank you so much. And thank you, Jessica, for those very concise and insightful presentations of very nice information. So now we come to the time during the webinar when we respond to the questions and concerns of the participants. So let me ask Kathleen first if it might help, Kathleen, just to review quickly how participants might raise their hand should they wish to connect by voice, and then see whether you have any questions that have come in to the question box.
Absolutely. Thank you, Bill. Yes, as I mentioned at the beginning, if you would like to ask a question verbally, please feel free. There should be a little button, a little raise hand feature. If you hit that button, that'll flag your name for us, and we can go through and unmute your phone line to enable you to be able to speak and ask your question. You may also type your questions in the questions box. Please feel free to do that now, and we'll address as many as we can in the next, I guess, 15 minutes or so. So we do have a couple of questions to get started. The first one is for you, Jessica. Is there a re-accreditation readiness assessment?
That is a great question. I do not believe that we have one yet. We are just now beginning the reaccreditation process. Our first health departments are going through that. So we have a number of materials available at the moment. I don't know if a readiness checklist is there yet, but that's certainly something to work on. I will say, in general, the reaccreditation requirements build off of the requirements that were in initial accreditation. There are not a lot of brand new topics. It's really taking what was in the initial, the standards and measures version 1.5, and then perhaps stretching them a little bit. But I think that's a great suggestion, and I will definitely bring that back to my colleagues.
Great, thank you. We have a question, essentially a two-part question, I guess, for both of you. Can you describe how academic health department relationships might work for MPH programs surrounded by small rural health departments serving populations less than 25,000 people? Do you have any thoughts on the implications for PHAB for small local public health agencies or for CEPH for MPH programs? Any thoughts on sort of the rural areas?
I can talk about that first, I think. It is harder in rural areas when you're talking about very small public health programs, as well as small sort of geographically dispersed public health departments. However, some of the most robust partnerships that we see are actually with those small programs and the small health departments. So they may not be kind of an official sort of academic health department in the sense that you think of on a health sciences campus with a large state health department. But we see some very close collaborations with some of those smaller programs who develop very close relationships between faculty and staff. They do a lot of, have a lot of the staff at the health department teaching with the faculty. They have faculty really helping them with a lot of the maybe kind of evaluation sorts of things that they do. So I think that, it might not be sort of, academic health department, capital A, capital H, capital D, but I think that there are it's very valuable, and there are some very, very robust partnerships that exist now in those smaller rural areas.
Thanks for that answer. This is, we do have a couple of thoughts. First of all, I will say that there are very small health departments that have been accredited. I believe last week we accredited a health department that serves a population of about 5,000, so that's our smallest yet. But there are a lot of smaller health departments who are really eager to engage in the accreditation process, and I think they would really appreciate having some support from nearby academic institutions. I think part of it is a capacity issue. So if there are ways that, as we talked about, having students and faculty members actually helping to do things like, participate in and be a part of the community health assessment process or the data analysis, I think having that additional capacity would be valuable. One of the other things I will say, we had a meeting recently with a number of small health departments that are interested in pursuing accreditation. And one of the themes that came up is that sometimes there are a lot of resources out there, but it seems a little bit overwhelming having just a huge number of choices and not knowing where to go. So we had the conversation specifically about, in terms of workforce, there are so many trainings and so many things out there, but how, if we're a small health department, we don't have a lot of time for training, so we really need to focus in on, what are the one or two things that are going to be most valuable for us in terms of professional development. So I think in those partnerships, that actually may be an important role that the academic institution can help play, is to just kind of funnel in. There's so much information out there. Same with the requirements around using available evidence and data. There's so much of it out there. Is there a way to streamline that and help the health department focus on the most important components?
This is Bill. I might just jump in for a moment just to remind everyone that academic affiliations with health departments don't have to come just from schools and programs of public health, of course. I think we sort of mentioned this before, but particularly health departments that may not have easy access to a school or program of public health, there are a variety of other kinds of academic institutions and departments that are relevant to public health, everything from health education to environmental health, to law, to medicine, to nursing, etc. So there's, from the accreditation side, there's probably a wider choice. From the health department accreditation side, that is, there's a wider choice of academic partners that are available.
Fantastic. And I know Sophie Wenzel is on the webinar today, and she has very generously offered to talk with anyone who's interested in AHDs in rural areas. So Linnell, I think the question about rural areas was yours, so we're happy to make that connection after the webinar. If others are interested as well, please feel free to let us know. With our next question, I think I want to pick up on something that you just said, Jessica, related to, you know, there's so much content out there. Someone does have a question about how do universities decide which local public health agencies or practitioners to develop or work with? How are local practitioners made aware of the resources that are available? So I don't know, Jessica or Laura, if you have thoughts on either that, or if anyone else on the call who has experience, feel free to share your thoughts as well.
So this is Jessica to the question. To the question about how health departments learn about resources. One of the key ways in which local health departments do learn about things is through national organizations like the National Association of County and City Health Officials, and so that is sort of a funnel that kind of helps health departments learn about resources. But another thing, and one of the things that NACCHO does is they run a learning collaborative for health departments that are pursuing accreditation. So that's one route, but the other thing, and this may be the one that's particularly relevant, is a lot of states have some sort of learning community among the local health officials in the state, and that can be a really powerful tool for accreditation preparation. I mentioned Kentucky as one example where the local health departments have really worked together to prepare for accreditation. There are a number of other states where you see those strong relationships. So I might encourage universities and schools to reach out to whatever the infrastructure in your state is, whether sometimes it might be called the SACHO, the State Association of County Health Officials, or whatever the name is, and however it's organized in your state. But I think that might be a great way to build connections with the local health departments throughout the state.
Fantastic. Well, if anyone has any further thoughts, please feel free to chime in. We have a question related to, I guess we have two questions related to resources. So to help health departments, this question is for you, Laura, sorry. To help health departments with research and adoption of evidence-based interventions, does CEPH have any requirements related to accredited schools and programs making their libraries available to employees of governmental public health agencies?
No, we don't have a requirement for that specifically. That's a really good question, though. I've never had that question posed. No one has ever raised that, but I can imagine that would be something helpful. My guess is at the university level, because our libraries are university assets as opposed to even assets of the schools of public health, that would be a university kind of decision. But that's a really good question. That is not a requirement.
Great, thank you. And we do know, I do know of a few academic health department partnerships where that has happened, that the sort of brokering the use of library services has been provided as part of that connection. So yeah, excellent. The sort of—
You might also, Kathleen,
okay. Yeah.
I mean, there are other sorts of resources that can be available through an academic institution. It could be meeting space, sometimes it can be assistance with training programs, be a variety of things that can come that don't necessarily come as dollars, but come as in-kind services or sharing of facilities and resources that exist.
Absolutely, thank you. So on the theme of sharing, if you will, Jessica, does PHAB have any requirements for accredited health departments to share their data with academic institutions so that they can engage in practice-based research?
Great question. So we do have as I mentioned, in Domain 10, which is our research one, we do have some requirements about health departments being engaged in research. It's not as specific as sharing your data with researchers, but it is particularly for the state and tribal health departments that they're participating in things like, you know, practice-based research networks. So that is definitely more broadly, you know, a component of the requirements. And of course, there are also requirements in general that that the data that health departments are compiling for things like their community health assessment and their surveillance, you know, that is shared with the public. So not necessarily perhaps in the form that researchers may want, but I think we do really emphasize throughout the requirements that there is that transparency in making information available to the community as a whole.
Fantastic. I'm going to backtrack us for a second, I guess, in terms of the idea of how do people know what resources are available. We have a comment that schools and programs of public health have practice programs, and that can be a good way to make that connection. Also, someone mentioned NACHO earlier, as well, the Association of State and Territorial Health Officials and the Association of Schools and Programs of Public Health. So the national organizations that are out there can help to make those connections for health departments with academic institutions. There's an interesting question, something I have not come across yet, so I'd be really interested, Laura, if you have any thoughts on this. In your experience, have you come across any academic institutions who prefer to only work with health departments whose executives have public health degrees or public health backgrounds?
Oh my gosh, I hope not. Well, let me put it this way. I've certainly never encountered that that sentiment said out loud, for sure. I can't guarantee that it doesn't exist out there, but that is, we would actually expect schools and programs to provide assistance in whatever way that assistance needed to be provided, and with certainly no discrimination based on whether or not the partner has a public health degree.
Thank you. I also have not come across that either. So I was sort of curious if I was just missing something. I think we are getting close to time. We have one sort of long-term future question that I'd love to throw out to get your perspectives on. And it relates to, do you think that at any point in the future, PHAB and CEPH standards might eventually require a demonstration of having a formal academic health department or that formal relationship in place? I don't know, I guess we could start with you, Jessica.
So I think that, you know, our states actually do require not something that's necessarily an academic health department, but we do for our states require, you know, relationships with and formal relationships with academic institutions. I think the reason why one of the reasons why that's a state requirement and not one that's for the local health departments is we don't want to require something that we know is going to be not feasible for a lot of local health departments. And I think, unfortunately, at this point in time, there are local health departments that if you ask them, they would say that they don't know that they have easy access to academic institutions. So on the one hand, we're going to encourage them to look more creatively and try to find those partnerships and think through, as we mentioned earlier, you know, maybe it's not with a school of public health, you know, maybe it's with a nursing program at a community college. So we certainly want to encourage that in any way that we can, but at least At the moment, it seems like perhaps too much of a stretch to require of all local health departments. But that's me making, I'm only speaking for myself there. It's not a conversation that PHAB has had, so I don't want to read the tea leaves too much to say what PHAB might do in the future.
Yeah, and I would echo what Jessica said. That is not a conversation that the CEPH board has had either. And one other sort of caveat there is that our evaluation is really based on the mission of the program, the mission of the school. We do have we have several out of 191 schools and programs who may have a mission where they define their workforce or their community, not necessarily at the local level, but their mission is purely international or something like that. So I doubt that we would make a requirement for something that may not be mission-based for all of our programs. But again, I'm just sort of thinking out loud. That's not something we've discussed.
Fantastic, thank you. I think we have addressed all of the questions that we currently have in the queue. And I know we're getting close to time, so I want to be conscious of that. If I've missed you or if you have any remaining questions, please feel free to just type them in the chat box and we'll follow up after the webinar about them. For now, I will turn it back over to you, Bill.
All right, thank you so much, Kathleen. I hope you've found this afternoon's webinar informative, and I'd like once again to thank our presenters for sharing their time, expertise, and experience with us. This last slide is here to give you an overview of the resources available through the Academic Health Department learning community. It's for those interested in exploring the nature of academic practice partnerships, or how to develop new relationships, or how to maintain and improve existing partnerships. And in addition to our regular webinars, you may wish to participate in our mentorship program, either as a mentor or mentee, or perhaps interact with our Ask the Academic Health Department expert column on the Public Health Foundation Pulse blog. You may wish to examine our library of Academic Health Department resources and tools on the Public Health Foundation website. And if you don't already receive it, you might want to sign up for our monthly newsletter called the Council on Linkages Update, which focuses on Council of Linkages activities that include the Academic Health Department learning community. So once again, thanks to our participants and thanks to all of you for spending some time with us today. We hope it's been a valuable experience for you, and we'll look forward to interacting with you on our next webinar. So thank you all, and good afternoon.